Best biomarkers, endpoints, and other tools resource is a FDA-NIH Joint Leadership Council initiative. The various categories of biomarkers considered include diagnostic biomarker, monitoring biomarker, multi-component biomarker, predictive biomarker, prognostic biomarker, response biomarker, safety biomarker, susceptibility or risk biomarker. A discussion of some of those relevant to cardiology with examples follows. There is some deviation from our conventional understanding of biomarkers in this concept by FDA-NIH BEST, initiated in 2016 and last updated January 7, 2025. This has also been cited in Braunwald Textbook of Heart Disease 12th edition. Diagnostic biomarker is used to detect or confirm presence of a disease or condition of interest or to identify individuals with a subtype of the disease. Interestingly, according to this, even ejection fraction is a diagnostic biomarker in patients with heart failure. I presume that cardiac troponins and B-type natriuretic peptides will also come under this category, as well as under some other categories. Monitoring biomarker is measured repeatedly for assessing status of a disease or medical condition or for evidence of exposure to or effect of a medical product or an environmental agent. International Normalized Ratio INR or prothrombin time PT is a monitoring biomarker in this context. Prognostic biomarker is used to identify likelihood of a clinical event, disease recurrence, or progression in patients who have the disease or medical condition of interest. C-reactive protein level may be used as a prognostic biomarker to identify patients with unstable angina or myocardial infarction with a greater likelihood of recurrent coronary artery disease events. Safety biomarker is measured before or after an exposure to a medical product or an environmental agent to indicate the likelihood, presence, or extent of toxicity as an adverse effect. Serum potassium levels may be used as a safety biomarker when evaluating patients on diuretics. That would be decreased levels. Angiotensin converting enzyme inhibitors, angiotensin receptor blockers, or aldosterone antagonists will have the other effect, increased levels of potassium as safety marker. Corrected QT interval, QTZ, may be used as a safety biomarker to assess the potential for drugs to induce tox at a point. Susceptibility or risk biomarker is one that indicates the potential for developing a disease or medical condition in an individual who does not currently have clinically apparent disease or the medical condition. Factor V laden may be used as a susceptibility or risk biomarker to identify individuals with a predisposition to develop deep vein thrombosis. C-reactive protein level may be used as a susceptibility or risk biomarker to identify adult patients with a greater likelihood of incident coronary artery disease. Please note that this is not a list of all biomarkers used in cardiology, just a pointer to a relatively new concept.